there was no scientific basis for mandates, as has been indicated by officials, why would your government institute a policy that infringed on Canadians' rights, that didn't have scientific basis, and then call a snap election a couple days later?
You mean the non-scientific mandates that was implemented by municipal governments? You mean the non-scientific based mandates that was implemented by provincial governments? You mean the non-scientific based mandates that was implemented by the private sector without required from government? You mean the non-scientific based mandates that was implemented by universities? You mean the non-scientific based mandates that was
Minister, I'm talking about the mandates implemented by the federal government at airports.
Governments around the world.
I'd like to quote one of your officials in court documents that were reported on by Rupa Subramanya, and one of those officials is on the call today, actually, and let me quote in an email. To the extent that updated data exists or that there is clear evidence of the safety benefit of vaccination on the users or other stakeholders of the transportation system, it would be helpful to assist Transport Canada supporting its measures. That's a quote from ADM McCrory. Now, the mandates were set to be implemented, but your department didn't even have the information that that indicated it was necessary or based in science. To just circle back to your question about the science that's being followed by municipalities and provinces, they have all eliminated their mandates since, yet you have not. So if you're following the same science they are, why have they all lifted their mandates, but you have not?
Mr. Chair, first of all, let me start off by saying vaccines have proven to have saved lives and continue to save lives. At a moment in time where our public health system is under a lot of pressure, vaccines continue to be an incredible tool in saving lives and protecting the health and safety of Canadians and our healthcare system. The federal government has suspended most of our mandates. The only mandate that we have is at our borders, like many countries around the world. And it is done to ensure that we minimize the importation of the virus and that protect the health and safety of Canadians. And let me point my honorable colleague, on top of all studies that have been done over the last 2 years, just the last 2 months, 2 different studies. One was done by the Canadian Medical Association. One was done by UBC, the University of British Columbia, that demonstrated that these public health measures, including mandates, protect the health and safety, have saved upwards of 60,000 lives, have prevented the importation of the virus tenfold at our borders. So there's ample evidence that I'm happy to table with committee that provides justification for these vaccines.
Well, thanks very much. We look forward to you tabling that information. Over 60 countries around the world have abandoned all of their air travel pandemic restrictions, including most of our European allies. And, PHAC internal reports suggest that air travel had almost no impact on COVID community spread, less than 1%. So it is questionable why those would still be in place. The minister, you're talking about, again, about science. The CDC in the United States, with whom we share a border, says that it makes the most sense not to differentiate between the vaccinated and the unvaccinated, and that sub-jurisdictions don't need to start making mandates. So, Minister, let's talk about the mandates that you still have in place. What are the current regulations for air and train travel in Canada with respect to COVID-19?
Mr. Chair, there are still many countries around the world that require a proof of vaccination for international travel.
Your mandates, Minister. I've got less than a minute.
Second, currently, the Canadian government has suspended our vaccine mandate for our transportation sector, so there is no requirement for domestic or international travel for people who are leaving the country, whether they want to get on a plane or a train.
So, Minister, do you have to wear a mask on a train or a plane? And if someone does not, what should be the consequence for that person?
Currently, we maintain a mask wearing policy for federally regulated air or train sector. It is scientifically proven that masks reduce transmission upwards of 80%. We're doing everything we can to protect the health and safety of Canadians, and it is the prudent thing. In fact, it's the kind thing to do to protect
10 seconds,
those
please, Minister.
sitting next to you.
Minister, your Prime Minister was seen not wearing a mask on a train just mere weeks ago. Was that not prudent or kind? Has ArriveCAN caused delays?
Mr. Keenan, I think you're trying to speak, if I'm not mistaken, but we can't hear you.
The ArriveCAN app is actually the vehicle for the provision of the medical information and public health information that is mandated through the Order in Council as issued by the Public Health Agency of Canada. And without the use of the ArriveCAN, for which we receive the information 99.5% of the time in advance in air and in marine, and just over 90% in land, that information would need to be collected either by paper submission or orally for capture and input by a CBSA officer. And so without the ArriveCAN, it would take far greater time to process individuals than it currently takes. And you can recall a period of time back in March and April of 2020 when this was being captured on paper. And we had significant delays at Canadian airports and at land borders. And so it's been a very efficient tool to allow for the capture of that public health information. Thank you.
Okay, thanks, Chair, and thanks for the response there. I think that's a contrast from the experience that folks have. That's a contrast with what I'm hearing from frontline officers with CBSA in my community. That's a contrast with what we're hearing from our international partners, that this has dramatically increased wait times at the border for a public health measure that is not or a supposed public health measure that is not keeping Canadians safe. If the purpose is simply to verify vaccination, and we're matching that of our American partners, they don't ask for a demonstration of proof. They just simply ask the question. I'm wondering if the officials would be prepared to table documents related to the continued use of ArriveCAN. I referenced in my comments to the minister, or my questions to the minister, the justification that was requested in the summer of 2021. I'm wondering if they could table with the committee, if they could agree to table with the committee the justification for its continued use.
Mr. Chair, I'm just doing a signal check. Is my audio coming through?
It is indeed, Mr. Keenan.
Great. I would repeat one point my colleague from CBSA made, which is that the ArriveCAN is a tool for efficiently collecting information that the Government of Canada requires travelers to submit as part of its ongoing COVID protection measures under the interim order under the Quarantine Act administered by the Public Health Agency of Canada. Second point is we would be happy to provide additional documentation. There's a lot of documentation on those orders, the rationale, and how ArriveCAN contributes to operationalizing the high volume of people crossing the border.
Thank you. So I would just say through you, Mr. Chair, that it's very efficient. I've crossed into the United States several times. I'm asked by Homeland Security agents if I'm vaccinated, and I say yes, and that's the end. So it's still an offense to lie, and so it seems excessive and redundant at best. So I had referenced some documents, again, some court documents that had been reported on that quoted one of the officials that we've got on our meeting today. And I'm wondering if he's able to speak to if it is standard practice for the government to create a policy and then ask for the supporting evidence for that policy after the policy has been created on the eve of its implementation. Is that standard?
Mr. Chair, I'd like to start off with a key point on the premise of that question and then turn it over to Mr. McCrory to further elaborate. I think a really important point here is that I think the members are referring to media reports about the information filed by Transport Canada in a court case on the vaccine mandate. What the media failed to report was that Transport Canada tabled and provided extensive evidence, scientific evidence, on the rationale for the vaccine mandate. That was not in the media report, but it was in the testimony and the filings of Transport Canada. We would be happy if it would serve the committee to provide a copy of that information that was actually presented by Transport Canada in court. I think the second point of context I'd like to provide is that throughout the sort of 2+ years of COVID, COVID has not stood still, and we have been evolving and adjusting the health measures at the border and in the transportation system throughout. In that process, we constantly seek updated information from Public Health Agency of Canada. And so there's an ongoing process of pulling information in from the Public Health Agency of Canada as part of our work and using their expertise and health measures to guide the development of our measures.
Thanks for that reply, Mr. Keenan. I guess in tabling that information with the committee, it would be important for you to note if that evidence was provided to Transport Canada before the policy was made, or if the policy was made before the evidence was provided.
I can answer that for you now, Mr. Chair, that significant health evidence was provided to Transport Canada throughout the entire period of COVID. And so from months and months and months before the vaccine mandate, as well as after.